Okay, so what is a mood disorder? I mean, you and I, and everyone listening to this, the whole world, we all have daily fluctuations of ups and downs in our mood. But we are able to lead, arguably though, normal lives. However, individuals who suffer from mood disorders have a continuous episode that persists day in and day out, where basically it's like wearing glasses through which they see the entire world. Now, these happen to be very pervasive, continuous, and they tend to be cyclical. So, and the likelihood of getting another episode depends largely on your history. So if you've had one episode, you have about 50% chance likelihood of getting another. However, if you've had 3 episodic or episodes of depression, you have a chance of 80% of getting another episode. So the history does matter. Now, mood disorders include all types of depression, because there are different categories of depression, but it also includes bipolar disorder. And sometimes clinicians refer to mood disorders as affective disorders to point to the emotional part of this type of disorder. Again, they're pervasive, they're cyclical, and unlike what most people think, you don't need a trigger to actually trigger an episode. So you can begin or start an episode of a mood disorder or a depressive episode with absolutely no trigger at all. In fact, you can have the most exciting thing in your life happen, but still get an episode of depression. It is a real medical disorder, okay? There's a very high comorbidity with mood disorders and other psychiatric disorders, such as obsessive compulsive disorder, very, very high comorbidity with disorders like anxiety, but also with general medical disorders. And let me expand on that last point in the next slide. If you can advance, Steve, please.
Yep, might just take a couple of seconds when you ask, that's all.
Okay. So why should we care? Depression, if left untreated, it's not inconsequential. Okay, so what does that mean? Other than feeling sad, I mean, if you're thinking, well, I'm okay with feeling down every now and then, I'll go through the episode and whatever, it doesn't matter. But unfortunately, that's not the whole story, though, because if we left untreated depression, or if you go through unsuccessful treatment, you have a much higher risk of coronary heart disease. You have a much higher risk of metabolic disorders such as obesity, diabetes, or insulin resistance, also osteoporosis, and if you live long enough, you have dementia, or your life is truncated where you age, the aging process is very accelerated and you go through premature death. So unfortunately, this is only a 40-minute talk, and I wish we had enough time to go into the cellular mechanisms of how depression accelerates aging. It's so scary that you would probably not finish listening to this podcast and run and seek treatment if you are suffering from depression. But suffice it to mention just one example of one study that was conducted in women with depression. And when researchers looked at a cellular assay of the aging process in depressed versus non-depressed women, the depressed women, in terms of the cellular assay, showed aging by 13 years, meaning that they were 13 years older than the non-depressed females. But I'll stop there in terms of the aging and depression story, and I will go on to the next slide to look at, very broadly speaking, at the different categories of mood disorders. You have what's called unipolar, meaning 1, versus what's called bipolar, meaning 2. The unipolar, which is sometimes referred to as major depressive disorder, and among clinicians referred to as clinical depression. And I want to make it very clear that this should not be synonymous with depression, because there are many different categories under that broad umbrella of unipolar depression. Then there's also what's called the bipolar, where you have a major episode or depressive episode, but that cycles with at least one manic episode of hyperactivity and heightened excitement. So if we go on to the next slide, we could look at some of the recent changes.